Hello everyone, my name is Samantha Kelleher. I'm here today with Teresa Nissenbaum and Reagan Pottle to discuss research we've been doing with Dr. Keith Darrow at Worcester State University. The research we're going to be discussing today focuses on changes in cognitive performance and treatment of hearing loss and tinnitus. So to give a brief overview of this presentation, we're first going to cover some background information, and then we'll go on to discuss the research question. From there, we'll go over the results and what they mean, as well as how our research will be continuing from here. All right, so to start off with hearing loss prevalence, hearing loss is the most prevalent sensory disorder in the world. It affects over 30% of adults 60 years of age and older. In other words, it affects 500 million people worldwide. The reason we care about this high prevalence of hearing loss is because there's lots of comorbid medical conditions that may occur with it. Some of these conditions include depression, anxiety, traumatic falls, hospitalization, and institutionalization, and dementia. For this research, we'll be primarily focusing on dementia.
Dementia is one of the comorbid medical conditions associated with hearing loss. The correlation of hearing loss and dementia risk may be the result of conditions associated with the two disorders, including social isolation, cerebral atrophy, which is the loss of neurons and neural connections in the brain tissue, and exhaustion of cognitive reserves, which is when some parts of the brain are working overtime to compensate for other areas. As mentioned, hearing loss increases the risk of cognitive decline and dementia. This increase can range from 200 to 500% depending on the severity of hearing loss. Unfortunately, there is no widely accepted or available treatment for dementia and cognitive decline, though 40% of all cases of dementia is considered potentially preventable. With this in mind, the focus of public health should be on understanding and promoting the 12 modifiable lifestyle factors considered most important to reduce one's risk of dementia. The most influential lifestyle factor for preventing cognitive decline and dementia is the midlife treatment of hearing loss. Several reports, including the Journal of the American Medical Association, have indicated that treating hearing loss may reduce the risk of developing dementia by approximately 20%. In the past decade, several reports have investigated the use of hearing aids on improving cognitive performance, perhaps the key to preventing decline. Hearing aid use has been found to yield significant improvements in global cognitive function, executive function, processing speed, and visual working memory, as well as improvements in auditory working memory in both quiet and background noise.
So for the data collection, there were 32 participants in total in the study. 19 participants were new hearing aid users, while 13 participants were experienced hearing aid users, meaning that they've had hearing aids for a certain amount of time. All of the participants underwent cognitive screenings using CogniView Thrive, which is a computerized test that folds into a portable laptop-like device, and it includes sidewalls to block out light. It has been cleared by the FDA to test cognitive function. CogniView Thrive is used on patients 55 years or older post-screening of auditory issues. It aids in early detection of cognitive decline. It uses research to test the 5 cognitive domains, and the participants were asked to complete small tasks that tested their cognitive domains, and they completed these tasks using a joystick on the CogniView Thrive. The overall score is a percentage of correct responses on a scale of 0 to 100, and the 5 cognitive domains that were tested were memory, visuospatial, executive function, reaction time, and processing speed. The participants were tested pre-treatment, so before hearing aids, 60 days post-treatment, and 6 months post-treatment. So this slide shows us the results for the memory tests that were done on CogniView Thrive. So CogniView Thrive defines memory as the ability to have information encoded, stored, and retrieved when needed. So participants underwent a few memory tasks on CogniView Thrive. As we can see from the data, before hearing loss treatment and after 60 days with the hearing aids, we see that there was a significant increase in the scores of memory after 60 days with the hearing aid use. And that is for both experienced and new users of hearing aids. So we see a significant increase in their scores after 60 days. So the results for the visuospatial memory, we see that CogniView Thrive defines visuospatial memory as the ability to process, interpret visual information about where objects are in space in relation to ourselves. Participants also went through a series of tasks that tested their visuospatial memory. The results showed that new users who had hearing aid treatment did not show a significant increase in visual spatial memory scores after 60 days. However, it was found that for experienced users, there was a significant increase in their scores after 60 days.
We saw significant improvements in executive function in both groups. Executive function is defined by CogniView as high-order cognitive functioning. This includes things like attention, reasoning, and working memory. At only the 60-day mark, executive function scores went up by 9 to 12%. Reaction time was defined as the period between the beginning of a stimulus and the beginning of one's reaction to that stimulus. Processing speed, on the other hand, is defined as the speed at which one can take in information, understand that information, and begin to react to it. So far, changes in reaction time and processing speed have not been significant, but we'll continue to track any changes here that we may see at the 6-month mark.
At this point in time, we can confidently say there are major improvements to cognitive abilities resulting from treatment of hearing loss. These significant improvements showed after only 60 days. As you can see here, memory improved 13 to 21%, visual spatial memory improved 12%, and executive functioning improved 9 to 12%. There was not a significant improvement in reaction time and processing speed at the 60-day post-treatment period. However, this may be a factor we will notice more at 6 months post-treatment. Overall, our final conclusion is that treating hearing loss does in fact significantly increase memory, visual spatial memory, and executive functioning abilities in just 60 days. The next steps in our research will be to collect data from all subjects for their 6-month post-treatment appointments. To date, we have received 6-month data from only 2 subjects and should have an influx of data within the next few months. We would also like to expand our research to 2 control groups by having a group of individuals with no hearing loss take the CogniView screener, as well as a group of individuals who have hearing loss but who are not pursuing treatment or interventions.